Hello, everybody. Welcome to our Global Wellness Webinar Conversation Series. Today, I'm very privileged to be your host at this Global Wellness seminar that we host every week. We're very excited today to be speaking with all of you, international audience from so many countries, from the west to the east to down under in Australia, where I'm located. Our conversation today is not to replace the care from your physician, and we make no claims to diagnose, treat, cure, or prevent. My name is Dr. Caroline Hong. I'm a doctor in dentistry, trained in Australia, hence the Bachelor of Dental Surgery after my name. I practiced clinically for 15 years and have been in the healthcare industry for 40 years. I'm still registered as a dentist in Australia, but over the years, I've moved to health services management and company boards directorship in the healthcare sector, business, not-for-profit organizations, and also community services. I've always had a passion for health and wellness throughout my life. As a dentist, I practice preventative dentistry, so getting involved in this company 3 and proactive wellness is just an extension of my passion and my clinical experience from decades ago. I'm currently talking to you from a beautiful beachside town called Port Macquarie. I'm sure many of you have not heard of Port Macquarie. It's 400 kilometers north of Sydney in New South Wales, Australia. Today, I'm very privileged to be interviewing Dr. Lana Wania-Galicia, someone I've known for many years, someone I've always admired for her professionalism in medicine, her humility, her philanthropy work, and also her willingness to serve others. So Dr. Lana and I will speak for 20 minutes. And we will then have 3 people join us in Australia to share their stories. So sit back and relax, and we will start our conversations, which I'm sure by the end of this session will have a lasting, insightful impact on all of you here today. Dr. Lana is a pain management physician and anesthesiologist. I think that's how I say it correctly, practicing in South California. She's also the chief medical officer at the Arroyo Vista Advanced Pain Specialist Clinic in Moore Park, South California. She's also one of our esteemed scientific advisory board members of 3. So welcome, Dr. Lana. We are so happy that you are able to give us your time today out of your busy clinical schedule. I know it's 5 p.m. for you there. We can't wait for you to share your story with us. So over to you, Dr. Lana.
Hello. Good evening, good morning, or wherever you are, whatever is applicable. Thank you so much for this opportunity to speak before you, though virtually. I can't wait to see you in person. Like Caroline, you are, I've been so waiting to see you. I was hoping I will see you I could, I would have visited you somewhere in Australia and also in Hong Kong, but the schedule didn't allow us, but it will happen, my dear. It will happen.
Sure,
you are so kind.
I'm sure
it will happen.
Perhaps, Dr. Lana, please share with us a bit about your background, how you became a pain management physician and an anesthesiologist in California.
All right, so let me begin I came from a very, humble beginnings in the Philippines. And it happened that I married my husband, who happens to be a Filipino-American. So I came to this country with just barely $100 in my pocket. All right. I only have $100 in my pocket, but I have this huge dream, the dream that I'll be able to make a difference in the lives of many, because of the fact that we have my foundation in terms of my family history. We are not a very health-wise, a healthy family. We have diabetes, hypertension, name it. And so I really wanted to do something that will make a big difference. So I came to this country. I did my anesthesia residency in Cook County Hospital in Chicago, and learned so much from my colleagues there. And after that, I came to to Northern California and did my pain management fellowship at the University of California at Davis up north. And there I came to realize that there is such a huge need for a pain management specialist. I'm sure a lot of people would even know that they couldn't believe that there is a pain management, a subspecialty in anesthesiology. Yeah, you have cardiac anesthesia and all those, but pain management is in its infancy. But really, when you get to this kind of a field, then you will realize that there's a lot of people out there that really require our service, but more so our making them understand, especially when you become a patient yourself. And that's what happened to me. And that's why I got so passionate about learning more about pain management. I continue to learn. And that's one thing that I will never stop doing, is to continue to learn. Learning is such a love for me. So that's about it.
Yeah, thank you, Dr. Lana. That's very inspiring, for all of us tuning in your work as a pain management physician and an anesthesiologist. You obviously specialize in anesthesia care, pain management, and critical care medicine, and you have all the essential knowledge to understand and treat the entire human body. So in your opinion, how important is it? What role does supplements play in your patient's overall wellness journey? And how do you typically integrate that into your healthcare regime for your patients?
Well, that's a very good question. A very good question. I'm glad you asked that. In pain management, yes, there is some. I tell patients when you see them and come to my clinic and evaluate them, and I ask them, what have you done in the past? What keeps you busy? And what are you doing now to take care of the pain? And I look at it as like a 4-leg chair. When you do pain management, you have the medical management, you have the interventional management, and that comes with injections or surgery or whatnot. And there is such a thing as also the affective component of pain management, where you help about their mental health. But a big portion of that is, what do you do? Which is, what are you putting in your body? And then that's very critical to identify that, to recognize that in pain management, you have to identify what are the potential triggers that can actually exacerbate or even bring about disease states, and then cause disease to even amplify or even worsen with improper intake of food or improper health maintenance, they call it, or abnormal inflammatory processes. And knowing this knowledge of having supplements, and what's important here is the right supplement and the right packaging of this supplement. Having that background knowledge actually empower me to tell patients, okay, my friends, yes, you're doing the right thing, but it's not enough. And having that background in the supplement and nutraceutical industry actually empowers me to share what is really vital. And that is right packaging and the right way to really put things inside our bodies.
Thank you. Thank you, Dr. Lana. You are a very accomplished physician and award-winning MD in the United States. And with great patient reviews, I've checked you out, and you run a very busy practice as well. Certainly adds a lot of credibility to have a group of very renowned doctors such as yourselves on our scientific advisory board, and also in an unpaid capacity. Additionally, all of our 3 supplements are accepted and listed on the PDR, and I believe it's one of the only company that has all the products listed, and so quickly, about a month after the products were made known to all of us. Why is that important from a physician perspective and from a consumer perspective, that all our supplements are listed on the PDR?
It is very powerful, Caroline, very powerful. It is actually, I call it a vetting process. It's a vetting tool. When your product is in the PDR, what physician desk reference delivers this critical information in written form. It's drug information and their resources. And these are actually a trusted resource for physicians. And when you start saying and telling that to your doctors, whoever doctors you're taking care, taking care of you, when you start telling them that, yes, all our 6 products are actually in the PDR, that is integrity. That adds up to the integrity of the products that we share, the information that we share. And we rely so much, us for providers, on those vital information. And just so people know, only very few companies in the supplements or nutraceutical industry actually have their products in the PDR. So it is a very reliable source, because you know why? Because those things that we have there have critical or clinical studies that would support. They have unique science behind them. That's why you can actually share it with even with your prescribing physicians or your doctors that take care of you. So it's really very important. It's very powerful.
Thank you, Dr. Lana. We use a different reference here called MIMS in Australia, but the PDR is very powerful, and a lot of doctors actually don't even know where to look. And many of the doctors actually learn about 3 from their patients, asking them questions on what do you think? So thank you very much. Dr. Lana, I've been a consumer of supplements for decades throughout my adult life. I know not all supplements are the same, and it's very confusing for the average consumer, even for doctors, to know very much about why 3 is different. So just in a snapshot, why are three supplements different from anything else in the supermarket, in a pharmacy, and how would you explain that in just a nutshell here?
It's the 3 pillars. The 3 pillars of 3, I think, is exploration, curation, and the absorption, the cellular absorptive mechanisms that sets us, these 3 pillars set us apart from all the other companies out there. That's more than enough, in fact, and it's clean. What we have is clean. What we have is reliable. The products that we have are reliable. I'm an anesthesiologist, so it's really critical for me to ensure that whatever I give my patients in the OR, it's important that whatever drug I give, make sure that it gives the effect right away. And it should be evident in a short span of time. And that's what we have, because we have this cellular absorptive mechanisms or technologies that combine with the vital critical nutrients or phytonutrients, for that matter, that are clean, that makes us different and I would say second to none in the nutraceutical or supplement industry.
Thank you, Dr. Lana. I'm going to ask you one very personal question, and I hope you can share that with the audience, because I know a number of the people in the audience have messaged me to say that they are here to listen to your personal story. You have a personal wellness journey, and I heard it before, and it's very powerful. And I think that would help a lot of people in the world, as well as the people who have specially dialed in today. So please share with us your personal health journey and how you managed that, and which then led you to your passion for this company.
Absolutely. Yeah, I signed the HIPAA, so we are okay here to share my story. But also, it's not just my story, but actually my family's journey, health journey. About 7 years ago, I actually had cancer. I developed cancer. I never thought that I'll ever develop that, but I did. And so I went through treatment, and I just came to realize that really life is so precious and life is short. And so from that experience, with the treatments, with the absence from work, and the worries that you have, and I'm sure some people probably shared the same sentiments with me at that time, that I was really at a point where you have a lot of questions why these things happened. And maybe because sometimes maybe I've done something that I should have not done in my life, including unhealthy lifestyle. I'm so busy. And when you are busy, what happens? You don't have time to eat, you don't have time to rest, you don't sleep well, and you just grab whatever you can grab just to fill your stomach when you're hungry. And I came to realize how important how life is, and how important health is, and how important preemptive wellness is. We do it now rather than wait until you get sick. But nevertheless, I had cancer. I have surgery. I had chemotherapy. I have radiation therapy. Name it. And through that process, I developed complications from the treatment and from the cancer itself, including I have a very retentive memory. In fact, I have a memory that, when I was in medical school, I just read a book and I remember it. I took an exam here in the United States for a licensing in the financial industry. I just read it one time and I was able to memorize even the questions during the examination. I probably remembered more than 80% of the questions, as I was able to put it together and help other people pass their exams. But I lost those. I lost that memory. And of course, the Lord, we have a wonderful God, and brought a wonderful person in front of me and said, hey, why don't you try this liposomal based nutraceutical products? And lo and behold, you know what? It dawned on me that when you take care of yourself and you spend time to learn about the products that you put into your body, and really understand the value of what you are taking, because it's so easy to go to the store, grocery store, or even pharmacies, and grab whatever you can grab. But once we need to learn what we're putting inside our bodies, what we eat, what we take, what we supplement our bodies with, and so I'm so grateful that I got to learn this wonderful products with such an amazing cellular absorptive technology, and I'm really I've gotten better, and the Lord is so good. I think I'm healthier when I was now than when I was 25 years old, because of the supplements that I'm taking, and it does promote health. It promotes vital function, bodily function, and I started sharing it with my very sweet family. The reason why I say sweet is because my mom has diabetes, my father has diabetes, and I started them on these wonderful products. Lo and behold, in just a few months, I got their hemoglobin A1C checked. Wow. I mean, call it a miracle. I believe in miracle. It happens every day, but that miracle will happen even sooner when you do something. And so that is my personal journey. I will never stop sharing this. I will continue to share it to the ends of the earth, and to every person that I touch. Every person needs to take this. And sometimes people would say, should I just take it when I have sickness? No, there needs to be a maintenance. Health can only be maintained. If you want to be healthy and you have that wellness and live a long, fruitful and productive and happy life, comfortable life, you need to take care of you now. You need to take care of you now, and take care of the people that you love, and every person that you can touch, you need to share. And you just have to share.
That's so powerful. Yeah. That's so powerful, Dr. Lana. I feel like I've known you for decades, and I just want to be there to hug you. Can't wait for the time when I meet you in person. We've been talking for a few years now. Your story is very, very powerful, and I'm sure it will help a lot of people in the audience, and also the recording when we start to share. So next we will move on. Thank you, Dr. Lana. Again, please stay on. We will move on to our next three speakers. We will have Therese Cameron and Rhonda Jacobs and the Honorable Andrew Stoner, who will share their stories with us. And first, we have Therese Cameron, dialing in from Sydney, New South Wales, Australia. Therese is an amazing woman. She has her own personal story too in her wellness journey, but she's also the founder of Diabetes Alliance with extensive background in diabetes education. She has a nursing background, and she held senior roles in the Australian healthcare system. Therese, thank you so much. I know you canceled some of your patients' appointments so that you can be here today to share your story, which I know will transform lives. So, Therese, over to you.
Thank you very much, Caroline. Yes, when I first heard about this particular product, I've heard about so many supplements, and I just said to somebody, "Oh no, I'm not interested." But somebody else, when you took some of them and she had amazing results, I suddenly became very interested. And what I found was, particularly with the Revive, I have also had a health journey. I've had cancer and a number of issues with joint pain and what have you. The Revive in particular relieves my joint pain within 24 to 48 hours. It's amazing. Normally, nurses are known to be a little bit, I do not take pain management if I can avoid it at all. So when I do get into pain, what I find is I'll take turmeric, and it usually takes about a week to work. Not with this one. This is amazing. It is truly amazing. And I'm currently actually 10 hours west of Sydney in a really, really remote location with Aboriginal community. And when I realized that I may not have enough Revive with me, I did a little panic. I was like, oh my gosh, because I knew I would be in pain. And, somebody kind of gave me another bottle. It was that important to me. And I suddenly went, oh my gosh, this is so amazing. For me, it has also been life-changing. Caroline will attest, when I first joined a couple of months ago, I was really quite sick. Somebody had to deliver the products to me. I had chest infections and all sorts of things. And I'm much healthier, and I'm also got a lot more energy. So where I'm living, there's nurses more than half my age, and they have far less energy than I've got. If 20-year-olds, again, I have much more energy than them. It's amazing how much energy I've got, and the full feeling of wellness. But the other thing is, because I did have cancer, I get a bit worried about, maybe it'll come back. So I happened to have a horrible fall and ripped a whole lot of the cartilage off my rib cage exactly in that spot. So, there's pain in that spot on an ongoing basis. The doctors told me I would always have pain in that location. And I never anticipated taking this and taking the collagen thing would reduce my pain. It just never occurred to me. And I have absolutely noticed a significant drop in the pain around my rib cage, which is such a relief to me, because then I don't have to be going, is maybe the cancer thing back or something. So it's amazing to have less pain, in my joints, to have amazing feeling of wellness and vitality that I haven't had for years. So I just do find the products good, and I am sort of telling all my colleagues, and they're a little interested. But again, we've got a lot of pushback with natural supplements because people have this preset idea that they don't work. But what I'm finding is they're amazing. It's been absolutely amazing and life-changing for me. So thank you very much, Caroline, for helping me to learn about this.
Thank you, Therese. That is so powerful, what you just shared. And stories like that we need to get out to the world. So Dr. Lana, would you like to comment on what Therese has shared? She talked about Revive, and also the energy that she's getting, and how she's, with her health, with her nursing background, how she's skeptical about taking supplements from the start. Yeah.
Yes, that's lovely. I'm really glad that you've got this tremendous effect from the Revive. It's one of my favorite products, being a pain management specialist. And the thing is, what's key here is when you said you have the effect right away. You have an immediate effect, and that's pretty evident the moment, a few hours or even a day or two after you've taken them. And that's my experience too. Some of the patients will actually use this. And one thing that's also important here to understand is, as you very well know, curcumin is a huge molecule. You need to package it well, that way it will be absorbed effectively. Hence, it will also give the effect that is desired. And that's what you got, Therese. And with the Revive 2, I was able to be able to taper my patients off of their narcotics. You very well know that in this country, 95% of narcotics are used here in the United States. 95% of the world's opioid manufactured, for the global use is 95% is actually used in this country, unfortunately. So I have this moral responsibility to share this product to my patients. And there's room for opioids, which is post-operatively, acute post-operative pain or acute pain. But when you are dealing with chronic pain, I think there is room for nutraceuticals like Revive. So it helped me. It really started to help me be able to get my patients off of their narcotics.
Wow. Thank you, Dr. Lana. It's so precious to have you here to also give your commentary on what Therese has shared. and could potentially be useful to some people in the audience. And next we thank you, Therese, again, and stay on. Next we will have Rhonda Jacobs from Port Macquarie, New South Wales. Hi,
Yes,
hi,
can you?
Rhonda.
Hi,
Yeah,
how are
yeah,
you, Carolyn?
fantastic, fantastic. I know it's been a little bit a struggle for you this
Oh,
morning.
it's been a
have to-
nightmare, and I actually can't see myself. I'm not sure whether it's up on the
We can
screen or
see
not.
yourself. Yes, you
Oh,
you are on
okay.
the screen and you look beautiful, Ronwyn.
I'm holding my phone, so I'm not sure. They said hold it
Oh,
higher.
no, you're fine, Ronwyn. We
Look,
so appreciate you. Ronwyn has
no,
a
thank you.
remarkable story to share with all of us. Ronwyn has even got her a carer to come in to look after her 91-year-old mom so that she could share her story with you. This is quite amazing. Even I'm brought to tears when she tells me about her personal experience. Ronwyn is an educator with an extensive background in childhood education. She actually owns an amazing childcare center for with happy kids in them, a happy philosophy in them. Yeah, it's got a beautiful name as well, and I personally visited it. So she's a teacher by training, and Ronwyn is going to share her personal experience in her personal wellness journey, and also not only for herself but for her 91-year-old mom, as you see in this slide. Ronwyn, over to you.
Over to me. Well, I'm just so pleased that I met Carolyn. We were in a bit of a state. My mother had been in hospital. She's 92 next month, and she had been in hospital for about 6 weeks with major difficulties, and as a result, she was placed on fairly heavy opioids, in pain. Anyway, I took over the care of her, and it was a nightmare. She was in agony at night time. She was didn't want to be alive. She said, look, just give me a pill. I just don't want to be here. And she felt she was old. She shouldn't be here. And anyway, I met Carolyn, and she sort of said, try these things. No, I must admit, I was a little bit skeptical, but I trusted Carolyn. So, and I too have been suffering with major, I suppose, inflammation type of things with carpal tunnel. I had numbness in my arms, legs when I slept, even when I drove. And I was even prepared to have an operation in my hands as they kept triggering shut, and I'd wake up with like clawed hands. Anyways, as a result, we started on them, and things have been very busy. But the difference with my mother, she now sleeps through the night. The pain that she's had for the last 10 years in her legs, which we think was a neuropathy type of pain, although no one could really tell us, that has completely gone. She is free from pain in her legs. She wants to be alive, wants to live, and looking forward to more great-grandchildren. And she's feeling better than she's felt in about 10 years. Her body seems to have balanced out, as mine has, and she's had breast cancer 2 types, and she's also been diagnosed with another type, which she is having immunotherapy at the moment. But I truly believe she wouldn't be alive without the 3 products. They seem to have balanced her out. She also has a bowel tumour, but she has gone from needing massive amounts of supplements to help her move her bowels, and now she's all she has is prunes and porridge and the products. So I'm just so grateful. It is life-changing.
Thank you, Ronwyn. Thank you, Ronwyn. Your story is amazing, and I actually could not believe what you shared with me when I met you, and then just a week after you told me, without me actually even asking you, you told me about the transformation that the products have made to your life as well as to your mom, Elaine, and God bless her. So, Dr. Lana, what would you like to say on what Ronwyn has shared with us?
Well, she hit the nail on the head right there. The key is balance here. Balance. There is normal inflammatory process that's necessary as we live, but when you tilt that balance, then disease processes starts to come into play. Disease brought entities will start to show up and manifest. So the key is balance. And how do we maintain balance apart from, proper diet and sleep, but also supplementation? We have so much depletion of our nutrients because of our busy lifestyle. And I'm glad that you use that word, balance. So we need to maintain. And when people ask me, what product should I use, doctor? What should I use this? Should I use that? I mean, if you have the opportunity to use all the 6 products, I think that is optimal. And they're all complementary and supplementary. So balance is key, right, Ronwyn?
Yeah,
Thank you.
absolutely. Absolutely.
Thank you, Ronwyn, and thank you,
No,
Dr. Lana.
thank you, Carolyn. Thank you so
Yeah.
much.
Next, we have the Honorable Andrew Stoner, my best friend, and also happen to be married to me happily. We can call him Andrew. So Andrew, I'm actually very grateful to you that you actually, got out really early, did your surfing so that you could rush home on time to do this Zoom. Normally you come home a little bit later in the morning. Andrew has a background in business and company directorship. He was in the Australian Parliament for 16 years and as a leader for 12 years, advocating for farmers and regional New South Wales. Today, he spends most of his time surfing, enjoys it, and living a dream lifestyle. And he serves part-time on a few Australian company boards. So over to you, Andrew.
Thanks, Caroline, and good morning or evening to everyone. When Caroline asked me to give a testimonial about 3 products, I thought, wow, which one? Because I take them all. And, I think Dr. Lana talked about balance before. By taking them all every day, I feel really fit and healthy. But I've landed on a couple of products which have something to do with surfing. I've been a surfboard rider since I was about 10 years old. It's one of the things we have plenty of in Australia, lots of beaches and lots of surf. So it's a great lifestyle, and once you've started surfing, it's quite addictive. So here I am 53 years later, I'm still surfing like a young guy. But unfortunately, along the way, I got some injuries to my knees. I actually had to get some medical procedures called arthroscopies, where they take bits of torn cartilage out of your knees, and your knees are never quite the same. So I found that in my 40s and 50s, I was slowing down. Surfing is really strenuous, puts a lot of stress on your body. You've got to be incredibly fit if you want to do it, at a high level, which I want to do. So along came 3, and Caroline said, look, you've got to take this Revive, it's anti-inflammatory. I think it will take a lot of the pain out of your knees. So yeah, I took it, and about 3 days later, she said, oh, how are your knees? And I said, oh my God, there's no pain. I mean, I didn't even notice, it was just the absence of pain. It's not a trigger other than you're feeling good. So it was almost instantaneous, as Therese said. And what that enabled me to do was really embark on surfing like probably I had in my 20s. And we're talking about, I'm now in my 50s. And I'm now in my 60s. And I just got fitter and fitter. And all the local guys around Port Macquarie, there's a local crew of surfers. They were all amazed, like, wow, Andrew, you're surfing every day, you're surfing longer, you're going out in really big and challenging waves. And a lot of these guys are a lot younger than me. So they just noticed, my health and fitness, which to me, the Revive had enabled me to do, to go back to that level that I once was. The other product that I landed on for the testimonial was the collagen. one of the other consequences of surfing for over 50 years is that my skin wasn't very good. So I was seeing dermatologists on a regular basis. Last year, I visited a dermatologist, and she said, "Gee, you've got a lot of precancerous lesions, particularly on your face, and you really need to cover up a lot more, and you're going to have to come back regularly." So again, I thought, collagen's just for the ladies. I wouldn't take it, but thank God for a good wife. She persisted and said, "You've got to try this collagen. It's not just for your face and your skin. It's also for your joints. It's really good. And it's got the absorption technology." So I gave it a go. And I went back to see the dermatologist, I think only after the first, box, you take 10 in a row. Went back to see the dermatologist, and she said, "Wow, you're better than you should be." She said, "You must have been covering up a lot. Your skin's looking better." So I think the collagen, again, it worked almost straight away, and now I'm going to keep taking it. And in fact, I've had some people say to me, "Gee, Andrew, you're actually looking younger than you did when you retired from politics," which was back in about 2015. So again, amazing results. But as I say, I take them all. I think they're all good. Thank you.
Thank you, Andrew. Thank you. What an amazing story. I'm so glad you're such an obedient husband that you listen to me when I say, "Please take the collagen." Dr. Lana, what would you like to say on Andrew's story?
Oh, that's so lovely. You know what? These products actually improve relationships too. Can you believe that? See,
Yes.
you look so pleasant. But anyway, the skin is the biggest organ in our body. It's the biggest organ, but really it's a reflection of what's happening inside of you. And it will manifest outward. If you are unhealthy inside, it will show up in your skin, and you'll see that when you're stressed out, it will show up. And the beauty about the collagen that we have is it's prime. It's superior because of the 5 grams of the fish collagen that is healthy from Scandinavia, and it's micronized, it is hydrolyzed, and it's lipose, and it combines that with the phytonutrients. It's just amazing. It stimulates our body and promotes our body to promote a good collagen, the production of good collagen again. That's why it manifests with a beautiful skin, a young and youthful looking skin. I'm so happy you got that result. I get that too sometimes. So thank you.
Thank you, Dr. Lana, and thank you, Andrew. Will all the speakers please turn your camera on? Okay, we're coming to the end of this session. Please stay on. I'd like to thank Dr. Lana very much for taking time out of your busy schedule. Also, Therese for sharing your story, and Ronwyn also. I know you're with your mom at the moment, and Andrew, of course. Dr. Lana, one last message as a take-home message for everybody in the audience. We have a few hundred people here in the audience tuning in.
I'm so grateful that the Lord put this company and its products into my life. And it gave me an extended family like you guys. I can't believe that I have that reach on the other side of the world. And I'm so blessed to have you in my life. But more so, it's time for us to share. We need to share this to the ends of the earth. A lot of people need this. We are growing a sick, especially in my country right now, here in the US. People are getting sicker and sicker. There are a lot more diseases that are coming up. We need to share. We need to be, we have that integrity, and we need to be proud of what we have here. We have something very special and unique. All we need to do is share. You open your mouth and share it to the world. Thank you so much, and God bless you all.
Thank you, Dr. Lana. So I urge every one of you here to please go back to the person who invited you to this session. I believe everyone has something to take home from all the speakers. thousands of people around the world in such a short time have joined our global wellness movement, inspiring lives of purpose, financial increase, and also service to others. Service to others is what motivates me to be hosting this global wellness. And I could go on and on and on. I'm so loving this session. And so remember that health actually is our greatest asset, and health is really our true wealth. So I'm Dr. Caroline Hong, Port Macquarie, New South Wales, Australia. Thank you for being the best part of today's webinar. Thank you, and God bless you all.